Hey y'all, Dr. McCullough here. I wanted to take just a minute today to discuss different indications for what we call an early phase treatment. Early phase treatment is something that is started on patients during the mixed dentition, which means that you've got baby teeth still present in the mouth and the permanent teeth are in the process of erupting. So one of the major indications and the thing that I see most commonly in practice that would indicate treatment is needed is a narrow upper jaw. So when we have a narrow upper jaw, a couple different things can happen. One of the things that can happen is that because the jaw is too narrow, there's not enough space in the jaw for the permanent teeth to come in. So inadequate space, a lack of space, is something that is easily addressed with an early phase treatment so that we can make sure that those permanent teeth are coming in the way that they should. Another thing that we commonly see because of a narrow upper jaw is what's called a functional shift, where a patient, because of the narrow jaw, does not have a comfortable bite. And so what the patient will do to get to a comfortable bite is shift their lower jaw to one side or the other, just so that they can close down. This functional shift is a very big problem because as patients are shifting during years that they are actively growing, it can actually lead to asymmetric jaw growth. So these are two of the most common things that I see in practice today that would lead us to recommend an early phase of treatment. There are other indications for early phase treatment, one of which would be maybe the upper jaw is not developing as it should and it's set too far back relative to the lower jaw. So that's an indication where we would need to do some type of orthopedic intervention and try to influence the growth of that upper jaw. And then we also have several different scenarios of just isolated tooth problems where maybe there's a tooth that's in what we call crossbite, where a top tooth fits on the inside of the bottom tooth when it should be on the outside, and it's causing gum recession. Or maybe we have a situation where a tooth is impacted and we actually have to pull it into the arch. So there's several reasons why a patient may need an early phase of treatment, but those are situations where if you have any questions or concerns, your orthodontist will be able to explain them to you and explain the importance of that treatment at that specific time. If you have any questions, please give us a call at 843-284-6497.